This career that I chose really started many years ago when I started an undergraduate school at East Carolina University. I met many different healthcare providers at that point who really led me in the direction of wanting to be an orthopedic care provider. Different healthcare providers, including athletic trainers, physician assistants, orthopedic surgeons, family practice physicians, and throughout my experience with all of those healthcare providers, I began realizing that I really wanted to be a physician assistant. I became a certified athletic trainer after graduating from East Carolina University, and then became a certified athletic trainer and worked at Marshall University for about 2 years while obtaining a master's in exercise physiology. Worked with the football team, several different programs including baseball, track, soccer. And then from that point on, I applied to physician assistant school and was accepted at Wake Forest University, where I completed my training. Following that, I worked in family medicine and urgent care for a year, and then went on to apply here at United Hospital Center to become a physician assistant in orthopedic surgery, which has been a great experience. The physician assistants and nurse practitioners provide a greater access for patient care than most people really recognize. The physician assistant and nurse practitioner are able to get patients into the clinic quicker to evaluate them, especially for fractures and sports-related injuries. A lot of times our orthopedic surgeons are in surgery and not able to see patients, but we have healthcare providers here 5 days a week and are able to see patients much quicker than some other institutions due to our utilization of mid-level providers. And I'm really excited to see how our practice has grown in taking care of patients through mid-level providers. And they provide excellent, high-quality care for the patient and connect patients to the orthopedic surgeon, getting them the services and care that they need. I want to be remembered as a healthcare provider who went the extra mile to take care of that condition. I want to be remembered as also as a Christian who prayed with them and provided that extra touch from heaven, maybe in the sense that maybe there was a point when they really needed help and there was nothing else left but God's touch. I want to be that healthcare provider that prays with the patient and helps them and be remembered from that standpoint as well. Healing begins here with our orthopedic team. However, I truly believe God's hand has to be in that to facilitate that. And so there's many cases where people are really having a hard time and they just need prayer. One of our patients that we've just finished taking care of, who just went home from the hospital, she had a really long, prolonged stay in the hospital and was there for 6 months and had a lot of medical issues arise, and every day she needed lifted up in prayer. I'm not saying we prayed with her every day, but I'm saying when she needed prayer, we prayed with her. There's been several cases where patients just need that extra touch from heaven. And I believe that we can offer our patients something, and that is the hand of God. That's prayer and healing through the Lord Jesus Christ that most healthcare providers aren't able to do. You know, I'm thankful that I work for a hospital that has such a background, that we are a Christian institution, and that is where we started. And I want to continue that tradition.